Hi, everyone. Welcome back to Body Talk with Rachel, where I, along with the help of special guests, talk about body concerns among different groups. I'm Rachel McIntyre. I am a doctoral intern at the Towson University Counseling Center, and I use she, her pronouns. And I'm excited to be joined today by Iris Mosah. She is a staff counselor at Indiana State University, and she has a special interest in working with clients on body and eating concerns, specifically among Black women. So I'm really excited to have her join today. So thanks so much for being here, Iris. Could you first just introduce yourself and share, briefly a little bit about your background?
Thank you, Rachel. Thanks for having me. It's good to be here. As you mentioned, I am a staff counselor at Indiana State University, and I am interested in this work, in this area of my field, because even prior to pursuing my career and just being a young Black woman trying to navigate life and having her own struggles with body image and eating, I noticed that within our field there was just a lack of inclusivity, a lack of cultural sensitivity, a very mainstream Eurocentric, just kind of one size fits all approach. And so as a professional, I have just been interested in trying to explore that gray area that hasn't been thoroughly explored, and hopefully improve the treatment experiences of Black women struggling with eating disorders through my advocacy work, through research, and through practicing and working with these individuals, one life at a time.
Wow, that's really, really awesome. And it's such an important area, as we'll discuss today, that the field of body and eating concerns is not that inclusive. So I'm glad we can really shed some more light to that and help build that inclusivity. So just to start off, I just want to note that we're going to be talking about these experiences generally, general ways that Black women may be struggling and affected by body image and eating concerns, but we are not able to include every perspective possible. So just please keep that in mind as you're viewing, that all perspectives are not going to be represented. So one of the major misperceptions about body and eating concerns is that they only affect women and mostly only affect white women, which really excludes the experiences of Black women who are struggling with body and eating concerns. We know now from more research and clinical work that Black women do experience body and eating concerns, but I was wondering if you could speak to how this misperception has come about and what's the evidence now that suggests it's not the case.
Yeah, well, as I mentioned before, our foundational understanding of eating disorders, who they impact, what they look like, just the psychological functions behind them, all of it thus far has been rooted in Eurocentric models and systems. And so it makes sense that, when we think of who has an eating disorder, we think of the white individual that all of the work in our field has been centered around. The problem with that, though, is that it leaves out a lot of voices because, in fact, research does show that it's not just white individuals or white women that are impacted by eating disorders. Eating disorders cut across, culture, socioeconomic status, racial, ethnic background, all of it. And particularly, I think, this misperception or this misconception that's out there is really harmful because, we have people struggling with eating disorders who don't fit that mold, and who, because they don't fit that mold and they don't see themselves represented in, you know, media representations of eating disorders or research or whatever the case may be, they might start questioning whether or not they truly have an eating disorder, whether or not their struggle is valid, and if they're deserving of seeking professional help, if they'll even be recognized as needing professional help. Because unfortunately, I've had Black women in my office with eating disorders who have gone to doctors and therapists and had those professionals pretty much try and dissuade them from the fact that they are struggling with an eating disorder, and who just, you know, wanted to explain away what they were experiencing rather than validating it and, you know, connecting the individual to the proper resources and treatment. So yeah, this misconception can really even impede our understanding and our knowledge of to what extent eating disorders are prevalent within these communities. And research, as I said, research has shown that eating disorders are of serious concern in the Black community as well. In fact, something that I saw out there in the research is that binge eating disorder is actually more prevalent in the Black community than it is in the white community. And I think there's another misconception or an extra layer of stigma there, such that I think in society, when we think about eating disorders, we primarily hear about anorexia nervosa or bulimia nervosa, and it leaves out binge eating disorder, which is also incredibly prevalent and particularly more prevalent in minority communities than anorexia nervosa. And so, you know, if we're not giving binge eating disorder that same, you know, attention and concern on a professional clinical level, then of course it's going to be hard for those individuals struggling in the Black community who are already questioning whether or not Black people get eating disorders. And there are a lot of cultural and systemic factors that contribute to that. But if I got into that, I would definitely go on a tangent. So I'm going to move on to the next interesting bit of research that I saw, which is that Black girls are actually 50% more likely to develop bulimia nervosa as compared to their white counterparts. And then the third thing that I saw that I thought was really interesting is that Black women who do develop anorexia nervosa will typically have a much more chronic, severe, lifelong case than their white counterparts.
Wow, that's really highlighting that not only are Black women affected by eating concerns, but they might be more affected even in many different ways than white women, really countering this misconception. I'm even thinking, I think it's even been found, if I'm recalling this correctly, that binge eating disorder is the most common eating disorder. So to think that Black women and other women who don't identify as white are the largest group to be affected by it, it really makes you think, what has been the foundation of eating disorder from such a Eurocentric lens? Yeah, it
Absolutely.
makes me think of another aspect of eating disorders that when I think of theory about eating disorders, it's thought to, one perspective at least, is that eating disorders develop from the exposure of stress and trauma, and can be a coping mechanism or response to the stress and trauma. And I think about the stress and trauma that Black women uniquely face compared to white women related to racism and racial trauma and perhaps other experiences of stress and trauma, and wonder if that increases their risk to developing eating disorders, or if you have any other insights in that perspective.
Yeah, well, one thing that I know for sure is that experiences of racism, discrimination, prejudice, they can definitely put Black individuals at increased risk of experiencing mental health concerns, primarily anxiety, as well as trauma related symptoms. And so, that being said, it definitely, in my mind, makes sense that those experiences could contribute to the development of eating disorders as a stress response or as a coping mechanism. A lot of times, eating disorders are a way for a person to feel a sense of control in their life. And there's definitely a lot of feelings of not being in control when you're being treated a certain way or you're experiencing something negative because of your skin,
Mhm.
which is something that you don't have control over, that you can't change. So, in my mind, it would make sense that one might, kind of decide, well, can't change that about me, can't change the plight of being Black in America, but I certainly can, change the size of my thighs or, the size of my stomach. So, yeah, and another piece of that, taking that a step further and going back to what was mentioned earlier about this Eurocentric um, understanding of eating disorders being associated with thinness. I think, again, because we associate eating disorders with whiteness and we associate whiteness with thinness, it would make sense to me that there could be a subconscious response, maybe some internalized racism that one might develop after experiencing racial trauma, such that they would now try and adapt to a body type that is deemed more valuable in society, that they have seen is deemed as more valuable based off of their lived experiences. Does
Yeah,
that make sense?
yes, that makes sense. What a powerful point, and really disheartening to think about the many ways that racism can really impact Black individuals and can lead to eating disorders that are considered the deadliest psychiatric disorders that there are. It also makes me think of just how we're really conceptualizing eating disorders and viewing them generally in terms of the diagnostic criteria. As you've mentioned, that so much of this field has really been developed and viewed from a Eurocentric lens with this idea of thinness as the goal. Though the diagnostic criteria is what it is for eating disorders right now. I'm wondering if you could speak to maybe the unique ways Black women may experience eating disorders, and if there are things that stand out to you of ways that maybe in the future could be modified to be more inclusive of Black women's experiences.
Yeah, well, one of the first things that comes to mind is what I mentioned earlier about there often being differing mainstream body image ideals in minority cultures. And so I think that opposition sometimes of kind of going against what the other Black women around them are maybe striving for, or what they deem as the desired body type, can evoke a lot of shame around identity, and almost like this tension between body image and uh, racial identity, because these misconceptions impact us. We soak them in, and they influence the way we feel about our lived experiences. So I would like to potentially see the DSM focus maybe a little bit less on this intense fear of weight gain as a criteria, because culturally that's not, going to be everyone's experience of how they're trying to change their body or the function of their eating disorder. So more focus on that function, that emotional function, that psychological function that we've talked about. And I would also say, in regards to what I've heard from clients, is that there's usually a generally negative and or dismissive response from the people around them, also because of these stigmas and these misconceptions. So, I've heard from clients who have had family members tell them, like directly tell them, like, just stop this, like this is a white girl thing, or like Black people don't have these kinds of issues, like you're being ridiculous, you're like seeking attention. So I would say probably more pronounced negative reactions from the people around them, simply because, again, we all have this ingrained idea of who the typical eating disorder sufferer is, and who it's acceptable to, who's acceptable or who's accepted as, a person who would be or who would struggle with an eating disorder.
Yeah, that's such a great point, and really highlights to me the barriers that exist for Black women to receive help if there's not perceptions from medical providers and perhaps other providers that these are concerns affecting them, and perhaps that being internalized too is further creating barriers. Are there other barriers that exist that prevent Black women to receive adequate treatment for body and eating concerns?
Yeah, well, aside from, like was just mentioned, which is professionals kind of missing the mark and failing to be culturally competent, I would say that there is still some growth to be had in regards to providing safe, inclusive, culturally sensitive treatment options, treatment centers. It's, again, like, I'm trying to imagine sitting in, for example, an inpatient setting and, being the only non-white woman with an eating disorder and being in a group setting and having all of these, like, all this cognitive dissonance and these thoughts around that intersection of body image and race, and just wondering, like, how safe I would feel in processing that with the group when there is no one else that looks like me, not even a therapist, not even a nurse, So I think representation is really important. Diversity is a buzzword, but there truly is a lot of power to having more diverse faces and bodies in our field, whether it's as the therapist or, in research, as the director of, X, Y, and Z treatment center, just kind of integrating Black bodies more into those spaces to just help it seem safer. So that's one thing. And then, like I said before, a lot of this lies in the hands of us as mental health professionals, us striving to do our jobs well, striving to do our jobs in a way where all voices and all experiences are valued and valid and important enough for us to to think about these things and to do research and to ask questions and to be open to learning and to not make assumptions and not just go along with the narratives and the misconceptions and misperceptions that you know, pervade our society and our field and our literature and our conferences. And you know, so just striving to do better on the therapist part and on the professional part.
That is so unbelievably true. You know, we really take on this responsibility to really debunk these biases and to ensure that people we're working with are receiving adequate care for what they need. And so important to be talking about how this view of eating disorders not being something that Black women experience can really be preventing them from, you know, disclosing this experience, feeling safe to disclose this experience, and receiving adequate treatment from their provider.
Mm-hmm.
Yeah, so I was hoping you could maybe speak a little bit to your approach when working with clients with body and eating concerns.
Well, I would say the cornerstone for me is transparency. So this is not going to be the elephant in the room for me and my clients. This is something, this intersection of body image and race. This is something that's going to be brought up in the first session. We're going to name it for what it is. And we're going to just have an open conversation because I want to hear how this mainstream narrative of eating disorders and body image has impacted you, the way you view yourself, the way you view your eating disorder, the way your symptoms manifest, the ways that you have been willing or unwilling to seek support or help. I want to know how all of this has impacted your lived experience. And through that, I want us to develop a plan for recovery that takes into account who you are, your culture, just like all aspects of your identity that are important to you. And I want you to have that personalized recovery experience that honors who you are. So that's really my approach, just having that collaborative style and naming these things early on, having these conversations so that my client knows that I'm open to it, you know, the whole ride. Like, let's talk about this. Let's do this together. How can I support you while honoring the unique individual that you are?
Wow, I love all of that. It sounds so impactful and wonderful for clients who have, you know, the privilege of getting to work with you, really naming these important components and naming that you can't tease race apart from these experiences.
Mm-hmm.
That's so important. So for the last question for our conversation, when thinking about people who are struggling with body and eating concerns right now, do you have any advice or suggestions you might provide them in maybe an initial step to increase their body acceptance?
Yeah, well, let me just start by saying that, you know, if if it has gotten to a point where you know that your functioning is being impaired in some way, whether that's your health, your social life, your relationship with yourself, your energy levels, whatever the case may be, just know that, you know, your experience is valid. If you're going to take away anything from this conversation that you just watched, your experience is valid and it deserves attention. And so if you are at that point, I would just encourage you to reach out, you know, and there are a lot of different ways you can do that, whether it's the initial step of just talking to someone you trust who could maybe be there with you and support you as you figure out, what to do next. It can be a support group. There are tons of them, especially in the wake of COVID. There's so much online now. So, maybe that's your initial step, just allowing yourself to be in a room with other people who may understand where you're coming from and who may be able to further validate your experience. So just, doing that next right thing, figuring out what that is for you. And then just for everyone in general, regardless of where you are and whether or not professional help is warranted, I think we need to honor the fact that our bodies are our earth suits. Like, we are on this crazy planet trying to get through, trying to navigate, trying to experience all that it has to offer. And we only have this one body, this one vehicle to experience it all. And once it's gone, it's gone. Once it's damaged, it's damaged. And so, we all have these unique spacesuits. There's no one size fits all. They all look a little differently, but they all have so much value. And for that reason, we should really work towards, at the very least, accepting them, if not loving them.
Oh my God, I am just, so enjoying this imagery of an earth suit and how important that is, and acknowledging that the first step is to acceptance, that
Mm-hmm.
maybe we're not there yet for loving our bodies completely.
Mm-hmm.
Let's start with the accepting component.
Absolutely. It does not have to be radical, but can you, at the very least, accept that it's the one body you have and commit to nurturing it rather than harming it?
Mhm. Oh, that's so great. Well, thank you so much for being a part of this conversation, Iris. I have learned so much as I continue to strive to make my approaches more inclusive. So I really enjoyed this conversation, and thank you for all of your insights.
Thank you.